My name is Dr. Seth Grossman. I'm an orthopedic spine surgeon. I started out my career as a computer engineer, actually. I worked in medical informatics and imaging, and then just made the switch to medical school down in Philadelphia at Jefferson. After that, I did my residency training in orthopedic surgery in New York at Albert Einstein College of Medicine. And then from there, I made the decision to go into spine surgery specifically, going out to UC San Diego in California for my spine surgery training. I've been with neurosurgeons of New Jersey for a little over a year now. I've been out in practice about 8 years. I've always been very interested in bones and muscles and those type of tissues. I played a lot of sports as a kid. I had my share of injuries. And I always just was fascinated with the human body and how it worked and all the amazing things it can do. So as I went through my training, I again became more and more drawn to that field. I got into spine specifically because, again, I like the challenge of it. I like that there's still an explosion. We're in the middle of a lot of growth in terms of what I can provide to my patients. So I do a lot of minimally invasive surgeries. I do a lot of motion preservation surgeries, so I try not to fuse. I do things like disc replacements. I do most of my surgeries through small incisions. I do quite a bit of robotically assisted surgeries, which I think is an up-and-coming technology that allows me to be more precise. I always take the time to go over my patient's imaging. I try to point out their pathology. I try to break it down in terms that they can understand. I use models quite a bit to show them what's going on. I really try to take the time to make that connection with the patient. I think patients appreciate that. I think that the most important thing in a doctor-patient relationship, again, is that personal connection. A lot of this is just, finding the right ways to educate. If you can explain something in terms that someone can easily understand, I think that you can really have a breakthrough there, and they can really empower the patient to make the decisions for themselves in terms of their treatments.